Hello. Czekaj, gdzie to się tutaj dodaje? Witam Was wszystkich. Nie wiem, czy mnie słyszycie, ale ja muszę najpierw dodać tutaj Patryka. Muszę wiedzieć tylko jak. O, jest Patryk. I jeszcze muszę dodać jedną osobę. Sorry, ale jestem trochę zestresowana, więc... Okej. Patryk jest. Nie wiem jeszcze jak mam dodać. Jeszcze muszę dodać kolejną. Hi.
Hi, how are you?
Hi, Patrick. How are you? I just
Good,
wanted to
good.
add. Do you know? Is it possible to add anyone else, or it's not possible?
I've only done this once before. I did it yesterday.
Yeah, it's the same as I. So I have actually problem, because I asked my friend if I have any problem with translation because I'm a little bit nervous. So I would like to add her, but I think that it is not possible to add another one person. I think so. Okay, so let me introduce you in Polish, okay? Firstly, and after that we talk, okay?
Yes.
Thank you. Słuchajcie, kochani, więc tak, trochę inaczej to planowałam, bo myślałam, że będzie można dodać jeszcze Monikę do tego live'a i będzie mogła nam pomóc ewentualnie w tłumaczeniu, jak ja się zatnę, bo jestem naprawdę mega zestresowana. Natomiast nie udało nam się to, więc jak coś, to ona po prostu będzie tłumaczyła ewentualnie na bieżąco w komentarzach, albo po prostu postaramy się jeszcze... Aha, dobra, nie da się więcej osób dodać, okej. Więc tak, skąd wiele osób nowych jest tutaj na profilu, dlatego powiem kilka słów w ogóle skąd ten pomysł o tym, żeby zrobić live z Patrykiem. Ja miałam wiele problemów ze zdrowiem i nie mogłam zdiagnozować w ogóle, co mi jest, więc przez wiele lat chodziłam po różnych lekarzach i po prostu nie mogłam znaleźć tej diagnozy. Okazało się po wielu latach, że było to stwardnienie rozsiane i neuroborelioza i po prostu nie miałam od lekarzy żadnych szans na przetrwanie, dlatego też zaczęłam szukać sama różnych sposobów na to, aby po prostu poprawić swoje samopoczucie, poprawić swoje w ogóle funkcjonowanie, ponieważ nie mogłam przez 5 lat w ogóle chodzić. I tak między innymi trafiłam na tą książkę właśnie Patryka Przewaga tlenowa, która bardzo, bardzo mi pomogła i też Wam ją polecam, także ja mam tutaj zaznaczone wiele rzeczy, natomiast wiadomo, że nie uda nam się dzisiaj wszystkich tematów poruszyć, natomiast mam nadzieję, że Wam także pomoże ta książka i chociażby ta rozmowa, tak samo jak mi pomogła. Więc najpierw będę zadawała pytania po polsku, a później po angielsku, żeby Patryk mógł swobodnie odpowiadać na nie zaraz jak ja je zadam. Czyli tak, Patryk, jak wiecie, miał również swoje problemy ze zdrowiem i chorował na astmę i on opowie już Wam za chwilę o tym osobiście. Natomiast on zaczął kontynuować pracę profesora Butejko, który zajmował się właśnie tym oddechem przez nos. Dlatego teraz zapytam właśnie go o to, jak to się stało, że zaczął tą pracę w ogóle kontynuować, czy miało to jakiś bezpośredni wpływ, jego zdrowie i tak dalej. So, Patrick, it's an honor for me to have you here today, really. It's a pleasure. And your book, helped me tremendously. So thank you very much. And I just introduce you to our listeners and also your book, Oxygen Advantage. And I would like to ask if you can tell us about yourself a little bit more, if any connection with your work, if the fact you continue Professor Buteyko has anything to do with your own health. Did you have did you have any issue with your own health, and after that you decided to promote
Yes.
this method, or how
Yeah,
did it
so
start?
I came across this by accident, and a lot of people who work in fields of health probably went into that area because of their own health. So I had asthma, I had sleep issues, and with that, your concentration is affected. I was falling asleep in school,
Okay, so
in
let
secondary
me
school.
translate just a little bit, okay?
Yeah.
Mam nadzieję, że większość zrozumieliście, natomiast Patryk mówi, że sam po prostu zazwyczaj tak się dzieje, że po prostu zainteresowujemy się czymś poprzez przypadek, tak? Czyli on sam miał bardzo duże problemy ze zdrowiem, między innymi z astmą, kłopoty ze spaniem, a przez to, jak wiadomo, jak nie śpimy dobrze, no to mamy kłopoty z koncentracją i dlatego zajął się tą metodą. Okay, you can go on.
And you know, when you breathe through an open mouth, most people don't realize that if they sleep with their mouth open, they will tend to wake up tired.
No i bo on właśnie wtedy zorientował się dzięki tej metodzie, że po prostu jeśli śpi się z otwartą buzią, to wiele osób po prostu no, jakby nie zwraca na to uwagi, natomiast wiadomo, że wpływa to bardzo na to, że budzimy się po prostu zmęczeni. Okay.
We should never wake up with a dry mouth in the morning.
Okay, you know, Patrick, I think that we can do this in English, okay? And
Yes,
after
okay.
that, I will try to add.
Okay.
No, because we lost a lot of time if I'm going to
Sure.
translate. You know what I mean?
Sure. Okay,
Okay.
so it's really important during sleep, during rest, and during physical exercise to breathe in and out through the nose. Many people sleep with their mouth open, and they wake up with a dry mouth in the morning, and they don't realize that if they changed from mouth to nose breathing, that their sleep quality would be so much better. I will say that mouth breathing is activating a fight or flight response because mouth breathing is fast breathing, shallow breathing. So it's causing activation of the upper chest, and we are breathing faster. So mouth breathing is also going to influence the state of mind. And during physical exercise, it's very important that we breathe in and out through the nose. However, few people do this. And the reason that they don't breathe in and out through their nose is because the air hunger is stronger when you breathe through your nose. However, when you do physical exercise and you continue nose breathing for about 6 to 8 weeks during all physical exercise, the air hunger goes away. Now, the body makes adaptations, and those adaptations are beneficial. Nose breathing increases oxygen uptake in the blood by 10%. So the pressure of oxygen in the blood is 10% higher breathing through the nose versus breathing through the mouth. Nose breathing is also increasing carbon dioxide in the blood when we do physical exercise. And carbon dioxide is necessary for red blood cells to release oxygen to the tissues. So we utilize oxygen better when we breathe through our nose during physical exercise than by breathing through the mouth. Nose breathing is activating the lower regions of the lungs. And the diaphragm breathing muscle is not just for respiration, but it's also for functional movement. It's for stabilization of the spine. So when we think of the core, we think normally, you know, we have to bear in mind that the core is like a box. The top of the box, the roof is the diaphragm. The floor of the box is the pelvic floor. The abdominals are to the front and the spinal muscles are to the back. People do core muscle strength exercises, but they don't always see the connection between breathing and core muscle function. So we need to look at respiration from a number of different angles. One is in terms of oxygen uptake. One is in terms of oxygen delivery. Nasal breathing also to help protect the airways. So, you know, I know initially when one switches to nose breathing during exercise, it is difficult, but this is where the training adaptation takes place. And I would say to people, our mouth doesn't perform any function in terms of breathing.
But you know, it is really funny because take a deep breath. You know, we can
Yes,
hear it everywhere, and it is a slogan. And what does it mean? You know, because
yes.
is it true? Is it a good breathing if we
Taking,
take a deep breath, or
yes,
you
yeah.
explain what does it mean actually?
If we breathe harder, if we breathe more air than what we need, we blow off too much carbon dioxide, and that causes blood vessels to constrict. So many people, when they are stressed, they will take a deep breath because they feel that's the right thing to do. But if they took 5 deep breaths, they will feel lightheaded. The harder we breathe, the more air we bring into our lungs, the less oxygen gets delivered to the brain. So if we breathe hard, intentionally increasing the amount of air that we breathe, it is not increasing oxygen delivery to the brain, it is doing the opposite. People who breathe too hard, too fast, will tend to have cold hands. And they have cold hands because the more air we breathe, the more our blood vessels constrict. So if you think of, I know people talk about, there is a belief out there that the more air we breathe, the more oxygen that's roaming throughout the body. It's not correct. It's really one way to deprive the body of oxygen is to breathe hard. And if we are in a habit of breathing hard all the time, we are not going to be in a good state of health. A good rule of thumb is that with breathing during rest, we should never hear it. It's difficult to see, and it's driven by the diaphragm and in and out through the nose. Now, my point here is that a deep breath just means that you are breathing using the diaphragm. If you were to look at a dog breathe, and if the dog has its mouth closed, and if you watch where the dog is breathing, it will be using the diaphragm. The cat is the same. A young infant baby is the same. So a deep breath doesn't have to be a big breath. A deep breath during rest should be silent, because there is, in terms of a balance, with breathing, it's about the biochemistry, the biomechanics, and the coherence of breathing. And many people think that in order to breathe deeply, we need to breathe big. And that's not the case.
Okay, so what we can do, for example, for our kids or for ourselves to prevent mouth breathing, and do you know any possibility to do that?
Yes, there's many exercises. If the nose feels congested, you can open up your nose by holding your breath. And don't do it if you're feeling pregnant, or sorry, don't do it if you're pregnant, or if, for instance, if you have anxiety or panic disorder. Just be careful with it. But if you want to open up the nose, take a normal breath in and out through your nose, hold your nose, and walk around holding your breath. And if you hold your breath, your nose will open up. The more we breathe through the nose, the better the nose works for us. And we also then use tape around the lips during sleep. And that's very important because during sleep, it's a time when we are not conscious of our breathing. And it's very important that we keep our mouth closed during sleep. The children's exercises, we have them in English, are free on the internet for children. All of the exercises.
Is it safe to tape your mouth? I mean, because I think that people can be scared about how could I tape my kid mouth. You know what I mean?
Yes.
Is
For
it safe?
children, we don't put tape across the lips for children. Instead, we use myotape, which surrounds the lips.
Okay.
And it's stretchable, so it surrounds the lips to bring the lips together, but it doesn't cover the lips. So we don't recommend putting the tape across the lips for children. But most adults are comfortable putting tape across their lips. Or they could use myotape, which goes around the mouth.
So these two exercises, it's the best for us at the beginning, or could you recommend anything more, or just two of this?
Yes, for sure. You can try a breathing exercise to improve your body temperature and to activate the body's relaxation response in about 4 minutes. If people focus on the airflow coming in and out of the nose and really slow down the speed of the air coming into the nose, and at the top of the breath bring a total feeling of relaxation to the body so that they have a relaxed breath out. The objective is to breathe less air. Slow down your breathing so much so that you take less air into your lungs. And by taking less air into your lungs, you feel air hunger. Air hunger signifies that carbon dioxide is increased in the blood. And as carbon dioxide increases in the blood vessels open up. So we have 70,000 miles of blood vessels in the human body. And we can influence our blood circulation, not by breathing more air, but by breathing less air. If we breathe more air, we get lightheaded. When we breathe less air, blood flow to the brain increases and blood flow to the hands increase. So I would say to people, experiment. Focus on the airflow coming into your nose and focus on the airflow leaving the nose, and gently start slowing down the speed of your breathing. And slow down the speed of your breathing almost that you feel hardly any air coming into your nose. And the objective is that you are doing it correctly when you feel air hunger. And do that for 3 to 4 minutes. You need to feel that you are not getting enough air. And in 3 to 4 minutes, check, is there any change in the temperature of your fingers? And if there is, you're looking for your hands to get warmer. You know then that your blood circulation has improved. But also check the saliva in the mouth. You should have increased watery saliva in the mouth. And that's an indicator that you have activated the body's parasympathetic response. So in terms of, it's very helpful for people with anxiety, it's very helpful for people with insomnia, but it's helpful for everybody because it's the understanding that if you want to improve your blood flow and oxygen delivery, it's not about breathing more.
Yes, actually, you know, at the beginning in your book, you mentioned that without food we can survive even more than a couple of weeks, without drinking a couple of days, but without breathing,
Yes.
we can't stay even a couple of minutes.
Yes.
What do you think? Why we don't think about our breathing habits? You know what I mean?
Yes,
We
yeah,
think
because
about food, we focus about food, we focus about drinking, and much more people think about the quality of it, but unfortunately we forget about breathing.
yeah, for many years breathing has been forgotten about, but now I think breathing is starting to get recognition with books and everything that's out there. And the thing about breathing is, Justina, it's not just about breathing using the diaphragm. We have to consider the volume of our breathing as well as diaphragmatic breathing. We have to consider the biochemistry, the biomechanics, and the cadence of the breath. I think part of it is because air is weightless and we don't see it. And, you know, it has been well documented since the American Civil War, with soldiers returning back from the front line. They were exposed to stress, and stress over a long period of time changed their breathing patterns. And when these soldiers came back into normal living, they had constant fatigue, they had exhaustion, they had breathlessness, they had a problem with their breathing. And it took these soldiers a long time to recover. So chronic hyperventilation syndrome has been around for a long time, and it's often caused by stress. And even when the stress is removed, the poor breathing pattern remains. Now, most people will not deliberately reduce their breathing to feel air hunger, but that's what we do because we want to change breathing patterns. If somebody is stressed, they will tend to breathe fast and shallow, but many people breathe fast and shallow all the time, and this is feeding into their anxiety, this is feeding into their stress, and it's also affecting their sleep. So in order to have calmness of the mind, we need to be able to influence the autonomic nervous system through the breath. One way to do it is gently softening their breathing to improve blood flow. Another way to do it is take very soft breath in, slow breath in, maybe counting for 4 seconds, but it's a very light breath, and breathing out for 6 seconds. When we have a prolonged exhalation, we activate the body's parasympathetic response. We stimulate the vagus nerve, we increase heart rate variability, and we improve the functioning of the autonomic nervous system. When we practice slow breathing and reduced volume breathing for a period of time, 20 to 40 minutes per day, over say 4 weeks, 5 weeks, our breathing starts to become more permanently slower. So we can make permanent changes to our breathing by practicing breathing techniques to achieve those changes. And the biggest effects it helps is people with asthma, people with sleep problems, and people with anxiety and panic disorder. And we also use it then for sports performance, for focus, for concentration, but also for reducing breathlessness during sports.
Because people ask about asthma and sleeping disorder as well, but so you already told us about it just a little bit, but do you have some kind of list what kind of disease we can maybe cure, maybe prevent if we do properly breathing?
Yeah, the Buteyko method has 20 clinical trials for asthma, and all of the clinical trials have been positive in whatever they were investigating. When I typically work with people with asthma, I do like
Do you have some
50% in 2 weeks.
You have some problem with the internet? Okay.
Do we have problems with the internet? I think so,
Yeah.
Lauren. So 1 second, sorry. Lauren, please turn it off. So in terms of people with asthma, we would expect 50% reduction of their symptoms in 2 weeks. So, you know, it doesn't make sense for people with asthma to breathe in and out through the mouth. But most people, or many people with asthma, do breathe through their mouth because when you have inflammation of the lungs, it travels up to the nose. And people with asthma will tend to have a stuffy nose. And if you have a stuffy nose, you are 1.8 times more likely to have a sleep problem. So if there is nasal congestion or hay fever, then sleep is impacted, snoring and obstructive sleep apnea. But the same principle applies whether it's for asthma, for snoring, or for obstructive sleep apnea, or for anxiety of the mind. We need to achieve a few things with our breathing. Number one is that our breathing should be light. Number two, our breathing should be low, using the lower regions of the lungs. And number three, our breathing should be slow. So light, low, and slow breathing, and we should never hear our breathing during rest. Now, what I'm talking about is functional breathing patterns. This is how you should breathe every day, every minute, every hour, every day. I understand that many people have questions on the Wim Hof technique.
Yeah, I just wanted to ask because, you know, it is like, you know, maybe it's not new, but it's one kind of method. And now we have to try to understand and also explain people how this, the method of Buteyko and if the method of Wim Hof is bad or not bad. What do you think about it?
The Wim Hof technique is a stressor. It's 30 large breaths, hyperventilating, to blow off a lot of carbon dioxide. When you blow off carbon dioxide, it increases blood pH, causes respiratory alkalosis. This is agitating the central nervous system. This is a stressor to the body. Then you hold your breath, you stop breathing. And because you have blown off so much carbon dioxide, you can hold your breath for a long time. So blood oxygen saturations drop quite low. So it's a stressor of the body to increase epinephrine. It's to stress the body to make adaptations to the body. The Wim Hof technique is useful as a stressor. However, It is not useful to breathe like that or have an idea in your head that this is how we should be breathing all the time. The Wim Hof technique switches you on, but it's also very important to be able to switch off. It's also very important to activate the body's parasympathetic response. We also do stress exercises with the oxygen advantage. We do breath holding. The individual breathes in, breathes out, they hold their breath, and they go for a run holding their breath. We drop blood oxygen saturation. We put the body into a hypoxic state, hypercapnia, high CO2, low oxygen, to stress the body, to delay lactic acid and fatigue. But we don't do the hyperventilation. So we have some similarities with the Wim Hof technique, but the major difference between ourselves and the Wim Hof technique is that we are concerned with everyday breathing patterns. How is the person breathing when they go for a walk, when they go for a run, when they are asleep, when they are at rest? Because ultimately we need an understanding of the physiology of breathing. And discovered back in 1904 is the Bohr effect, that the carbon dioxide pressure in the blood is very important, that as carbon dioxide in the blood increases, blood pH drops, and the affinity of hemoglobin for oxygen reduces. In other words, our red blood cells release oxygen to the tissues and organs in the presence of carbon dioxide. Now, even though that was discovered back in 1904, people often believe that if they breathe hard, that there is increased oxygen roaming freely throughout the body. And they believe if they breathe hard, then they can hold their breath for a longer period of time, due to the amount of oxygen that's in the blood. It's not. You hold your breath for a long time following hyperventilation due to the depletion of carbon dioxide. So I think it's very important that when people are teaching breathing exercises, that they understand the physiology behind it. And we have to bear in mind that there's many people will teach breathing exercises to improve the function of the diaphragm. But in the process, they will ask their students to take these big breaths. Yes, they are improving the function of the diaphragm, but in the process, they sacrifice biochemistry. When we work with breathing, we cannot sacrifice one dimension of breathing to the benefit of another. We have to look at that. If I'm giving breathing exercises for the diaphragm, I don't want to sacrifice the biochemistry in that instance. I have to have a balance between the biochemistry, the biomechanics, and the cadence of the breath as well.
Yeah, yeah, that's true. And I think also many people ask about the Wim Hof method, and it is just breathing like, you know, maybe 10 minutes during the day,
Yes.
or it's some kind of a session, yes? And
Yes.
the method of Buteiko method is mostly about habits, yes?
Yes.
I think that that's the most important difference between
Yes.
these two methods. And
Yes.
also if we, for example, take our kids, yes, and we can see them, I don't know, watching TV or doing something, and they have opened their mouth. So that's the problem from the beginning, and it's we have to learn them how to breathe properly, because it's not going to help only one method. Yeah, it has to be a habit. How to breathe every day, every
Yes.
minute.
Yes. Yes. The Buteiko method is about changing your breathing patterns to improve oxygen delivery throughout the body, all the time. It's also about achieving slow and low breathing to have a greater calmness of the mind. It's also about improving sleep. So it really is about looking at your everyday breathing. For children, 25 to 50% of studied children persistently mouth breathe. When the child has the mouth open, they don't have their tongue resting in the roof of the mouth, and as a result, the pressures exerted by the lips and by the cheeks are pushing the jaws inwards. The jaw gets smaller, there's not enough room for teeth, there is overcrowding of teeth, The child has crooked teeth, but they also have jaws that are set back. Their airway is compromised. Their sleep is compromised. We know that mouth breathing contributes to sleep disorder breathing in a big way. We also know from a study that was conducted in London or in Stratford-upon-Avon in England, 11,000 children over 8 years. Children with sleep disorder breathing, they had a 40% increased risk of special education needs by age 8 if untreated. Now, unfortunately, very few medical personnel are encouraging children to breathe through the nose, despite the evidence that's out there about importance of nasal breathing. Children who are mouth breathing, whether it's during rest or during sleep, these children, their faces are developing, they've got cognitive development, and children who are tired, they have 10 times the risk of learning difficulties. Their speech is impacted, their posture is impacted, their dental health is impacted, asthma, and many other conditions that can be related to poor breathing patterns.
And I just wanted to ask, because some people also asked about do you have any evidence? I mean, I believe in this method because I also do this every day and I practice it, and for me I am an evidence, you know. But
Yes.
Buteiko, please tell us something about Buteiko, because I read about him and about his work. And he was, I know that he was in England and he was the expert of asthma in hospitals, yes? So it's not a method like the new method, maybe we can try or not. It's based on some research and knowledge, yeah?
The research on the Buteiko method is mainly with asthma. But if we look at sleep apnea, and if we look at the work of Dr. Christian Guilleminault, and Dr. Christian Guilleminault is one of the founding fathers of sleep medicine. He has written many papers on the importance of nose breathing during sleep. So there are many papers. We have to ask, what does the Buteiko method say? The Buteiko method says, breathe through your nose. What does the nose do in the human body? It increases oxygen uptake. It's directly harnessing nasal nitric oxide. Nitric oxide is a bronchodilator for the lungs. The nose is connected to the lower regions of the lungs. And if we also look then at what does Buteiko say? Nose breathing, slow breathing, low breathing. There is research from Stanford and there are hundreds of papers looking at the benefits of slow breathing and heart rate variability biofeedback. So the Buteiko method doesn't have much research, but slow breathing has hundreds of papers. The nose, if you open any medical textbook, you will see the functions of the nose include breathing. The mouth has absolutely no role to play in breathing. The mouth does nothing for the breath. The mouth doesn't warm the breath. The mouth doesn't moisten the breath. We don't harness nitric oxide by breathing through the mouth. And the mouth is activating a fast and upper chest breathing. So, you know, look at the Buteiko method and what it achieves. And then we look at the physiology behind that. I would say to people, look at the oxyhemoglobin dissociation curve. Look at the Bohr effect. And there is so much evidence out there now. But yes, Buteiko was more about asthma, but it's not just about asthma. It's for general health.
Yeah, I think that, you know, just we have to try, and that's the main thing. If you try and you see the evidence on yourself, it's going to be
Yes.
the evidence for you, and that's the most important, yeah, because
Yes.
and I would like to ask something about sleeping, you know, because we produce pillows, as you know.
Yes, of course.
So, and also people ask about how we can you know, because many people have a lot of problems with sleeping disorders, yes.
Yes.
sleep apnea, but also snoring,
Yes.
anxiety, and
Yes.
whatever. So, what do you recommend to do to have your sleep better?
There is a measurement that's used in Buteyko called the control pause. And the control pause for adults is you take a normal breath in and out of your nose, you pinch your nose, and you time it in seconds until you feel the first definite desire to breathe. It's a measurement of the comfortable breath hold time. In sleep medicine, Dr. Luciano Messino published a paper in 2018. He's a Harvard medical doctor using breath hold time as a measurement of loop gain in obstructive sleep apnea. So here we see the science is starting to catch up. We have been using breath hold time for 20 years, and now sleep medicine have brought breath hold time as an indicator of one of the phenotypes of sleep apnea. To achieve good quality sleep, there are a number of things that we need. Number one is breathe in and out through the nose. Number two, light breathing. And as the control pause increases, breathing becomes lighter. And if you breathe lightly, you are less likely to snore. Even if somebody has a bad nose, they will still snore, but they will snore less. So nose breathing, light breathing, slow breathing, and breathing using the diaphragm. Because when we breathe using the lower regions of the lungs, it increases lung volume. And when there's an increase to lung volume, there is a stiffening of the throat, so it's less likely to collapse during sleep. If you look at the papers of Dr. Christian Guilleminault for sleep, he talks about the critical importance of restoring nasal breathing, both during wakefulness and during sleep. He was one of the top sleep doctors in the world. He came up with the name obstructive sleep apnea. He also developed the apnea-hypopnea index. He passed on about 6 months ago, maybe 8 months ago, but for the last 5 years, he has been putting out a lot of research about the importance of good breathing patterns. For insomnia, we really need to have a quietness of the breath, to have a quietness of the mind. If we are breathing fast and mouth breathing and upper chest breathing, the mind is agitated. Fast breathing, stress causes fast breathing, but fast breathing feeds back into stress. Stress causes upper chest breathing, but upper chest breathing feeds back into stress. So in order to relax the body, it's not about taking it's not about taking the big breath. It's about gently breathing in through the nose and slowing down breathing and having a very relaxed and gentle exhalation with lateral expansion and contraction of the lower ribs. And that way, we can activate the body's parasympathetic response and we can help to improve the depth of sleep. But I would say just even simple, any of your listeners who wake up with a dry mouth in the morning, they are more likely to snore, they are more likely to have obstructive sleep apnea, they are more likely to have disruptions to their sleep, maybe to get up to go to the bathroom during the night, and when they wake up in the morning, they are more likely to be tired. So the first thing that they could do is check, is their mouth dry when they wake up in the morning?
Yeah. Yeah, I know what do you mean, because I used to have it dry mouth in the morning, and I was very, very tired every morning,
Yes.
And when I tried to tape my mouth at the beginning, it was really bad, I couldn't stay with the tape maybe 2-3 hours, but no more.
Yes.
But now, for me, it's like obvious that I'm going to sleep with my mouth closed, and actually it helped me a lot. But I would like to ask about this question. It was good that you take a breath through your nose, and out through your mouth. Is it correct or not, and why? Because if you go
Yes.
to yoga class, or if you go to Pilates or any other active, gym or something like that, many people tell you about just,
Yeah. Yes. I don't know why it's so popular to breathe in through the nose and out through the mouth. Number one, your nose, as you breathe in, warms and moistens the air. And as you breathe out through the nose, your nose traps the heat and moisture. So it recovers moisture from the breath. When you breathe in through your nose and out through your mouth, you lose 42% more water. So you are more likely to get dehydrated. If you are breathing in through your nose and out through your mouth, your nose is more likely to be stuffy. If you think of elderly people in nursing homes, elderly people often breathe fast and through an open mouth, and they can be very dehydrated. But if you look at the animal kingdom, no animal on earth breathes in through their nose and out through the mouth. The young infant baby does not breathe in through the nose and out through the mouth. And I think we have to consider that nature is very intelligent. If there was a benefit to breathing in through the nose and out through the mouth, it would have happened throughout our evolution. I can understand in India, whereby it can be very hot, that to cool down the body, you breathe in through the nose and out through the mouth to get rid of temperature, to reduce temperature. However, in the process, you also reduce moisture, you lose moisture. So it doesn't make sense. I cannot think of any valid reason why we should be practicing breathing in through the nose and out through the mouth, and especially not in our everyday breathing. It's in and out through the nose.
Yeah. And so could you please tell us, because not everyone know your book and this method. So for these new people who are interested in this method, how should they start to breathe properly? I mean, maybe not breathe, but for example, should they buy this book or the other one, or just watch the YouTube video, because I know that you have a lot. What do you think? What is the best choice for this newbies?
Yeah, probably the book has got the most information. So the books are really a good place to start. There are a number of books in Polish. One is Anxiety Free, one is Close Your Mouth for asthma, and the other is
This
The
one
Oxygen
I can
Advantage.
recommend it because it's really, really important. It was really important for me, and it is. It's like maybe not Bible, but it's what I mean. That it's
Sure,
very
sure, sure.
important, and you have to go back there and check once more, once again, and so.
Yes, yeah. And there are videos on YouTube on our Buteco Clinic channel. And also there is buteco.pl as well. So there will be information in Polish. I'm not sure how many videos are in Polish. All of my videos, of course, will be in English. But we do have a lot of videos for children, and we have the entire breathing program for children is free. It's free of charge, but it's in English. And that's from our website, butecoclinic.com.
Yeah. Okay. I think that I just wanted to ask, do I have anything more here? I just wanted to say that in my case, I have Lyme disease, and I couldn't find a reason of my many symptoms, because it took a lot of time. And I can say that this method was really tremendously, and it helps me, because I had a lot of problems with arrhythmia, a lot of problem with anxiety, and I couldn't sleep, and
Yes.
it was the worst, because if you can't sleep, you can't regenerate your nervous system. It's constantly on a high level, and you
Yeah.
can't sleep, so you can't be, you know, just you know, if you can't sleep, you can't do anything, you know,
Yes,
because
of course. Yes.
your body is so tired that
Yeah. Yes. And this is, you know, in terms of helping the body to recover, which it has, if it has been disturbed by stress. Slow breathing there is a huge amount of research out in it as well, since the 1990s, looking at what happens when you slow down your breathing to 5.5 or 6 breaths per minute to improve heart rate variability, which is an indicator of parasympathetic sympathetic balance. And it's an indicator of resilience. So I would agree with you. If sleep is not right, nothing is right, because you cannot function. And I meet so many people coming in with depression, and I talk to them and I ask, how do you wake up in the morning? And they will tell me that they wake up feeling exhausted. And I ask them, has your doctor ever asked you about your sleep quality? And most of the time they say no, because the doctor is thinking it's the depression which is causing the exhaustion. But maybe it's the exhaustion that's causing the depression. We have to consider the bidirectional relationship that's going on here. And exhaustion and stress and chronic hyperventilation syndrome are linked. And sleep is also messed up in the process. So by changing breathing patterns, and I would say for people, even just practice it. You sit down, put one hand on your chest, one hand just above your navel, and gently start slowing down the speed of your breath to the point of a light air hunger, and see what changes it can bring on.
yeah. Yeah, but mostly doctors tells you that you know, you can take a pill and it's going to
Yes.
resolve your problem. But we know that it's not the point. I think that we have to. I think that we have to finish. But I would like to ask about the time of this exercise. What do you think? What time during the day is the best to do this? For example, in the morning. In the morning, we have to check our control pulse. Yes.
Yes.
And
Yes.
but if I know that if I can't sleep, I always do the exercise to slow my breathing in the evening, because if
Yes.
I had a lot of work during the day, a lot of stress. Even today, I was very stressed before that live. You know, I just try to breathe very slow. So I can say that we should do this in the evening if we have any problems with sleeping disorders or
Yes.
anything like that.
Yes. It is really important to slow down breathing to achieve air hunger for 15 minutes before sleep. It's very important because it gives us a down regulation. It's helping to activate the body's relaxation. If we go to bed and if we have a lot of thoughts in our head, it's very difficult to fall asleep. So what people could do is do all of their physical exercise with their mouth closed, walk with the mouth closed. When they have some time, spend 10 minutes, maybe 10 minutes 4 times daily, gently slowing down their breathing to the point of a light air hunger. And then in the evening, 15 minutes of gentle, light, slow breathing with air hunger. And it's about the balance between air hunger, breathing using the diaphragm, and slowing down the breath to 5.5, 6 breaths per minute.
Okay. And one more question. I know that it is in a book, but I know that pregnant women shouldn't do this exercise, yes?
Yes, definitely don't do any breath holds for pregnant women. Pregnant women could do gentle relaxation. But for most people, gentle, slow, light breathing is perfectly fine. But for pregnancy, No, just relaxation and nose breathing.
Yeah, okay. Okay, so Patrick, thank you very much for your time. It was a pleasure for me. It was a huge stress, you know, but your method, I mean, the Buteco method helped me to, you know, just calm down. And I'm really happy that it's finished. I know that you don't believe it because you do this every day, but for me it was a huge, you know, event. So thank you very much. I think that we can do this again maybe one time.
Of
And
course, of course.
so have a nice
Great,
evening. And I think that many people are thankful
great,
as well. Thank
great.
you.
Thank you so much, Christina. Bye, bye, bye.
Bye. Kochani, ja to też zakończam już. Czekajcie. Bardzo Wam dziękuję za to, że uczestniczyliście. Mam nadzieję, że wiele żeście zrozumieli z tego, co Patryk mówi. My postaramy się ten filmik oczywiście, znaczy na pewno go zapiszemy, na pewno go przetłumaczymy dla tych, którzy nie wszystko zdołali zrozumieć. Przepraszam Was za jakieś tam moje błędy językowe, ale naprawdę stres dla mnie był ogromny, także cieszę się, że to już się skończyło. Mam nadzieję, że wiele z tego live'u, nie wiem, nie będę tego już odmieniać, dla siebie wyciągniecie. Natomiast to, co mogę Wam powiedzieć od siebie, to na pewno to, że musicie przeczytać tą książkę, bo niestety nie jesteśmy w stanie, ani ja, ani Patryk, zresztą ja też nad tym siedziałam wiele godzin i nadal będę to zgłębiać, tą metodę, więc na pewno to wymaga więcej czasu niż tylko i wyłącznie godzina. Natomiast myślę, że Was chociaż zaciekawiłam tą metodą i że będziecie na pewno starali się chociażby zgłębić tą wiedzę i może akurat Wam ta metoda też pomoże, ponieważ mi ona bardzo pomogła i też mojemu synowi, który ma bardzo często, znaczy teraz już nie, ale miał takie początki astmy i problemy z oddechem i też robi te ćwiczenia. Jest oporny dość w tym, pozdrawiam go, jeśli mnie ogląda. Natomiast jak tylko ma zatkany nos, to polecam Wam, jeżeli w ogóle Wasze dziecko ma jakiś tam katar, coś się zaczyna, to właśnie zrobić to ćwiczenie oddechowe z zatkanym nosem, czyli zatykamy nos, wypuszczamy też powietrze nosem, zatykamy nos i wtedy robimy takie ćwiczenie, jakby taki ruch głową. Zobaczycie sobie to na YouTube. I ono naprawdę bardzo pomaga właśnie w takim odblokowaniu nosa. Myślę, że warto nauczyć dziecko od samego początku takiego ćwiczenia w formie nawet zabawy, nawet wtedy, kiedy nie ma zatkanego nosa, bo jeżeli będzie miał jakiś tam katar, to łatwo wtedy będzie można go zachęcić do takiego ćwiczenia. Także po prostu Was zachęcam bardzo do tej książki. Jeszcze raz Wam ją pokażę, możecie ją znaleźć też u nas na stronie. Nazywa się Przewaga tlenowa. Tam są też inne książki, które mi osobiście bardzo pomogły. Znajdziecie to w Justyna Poleca. No i co jeszcze mogę Wam powiedzieć? No jeszcze raz Wam dziękuję za to, że nie przeklinaliście do mnie w trakcie tej rozmowy, bo też pewnie bym się zestresowała, że coś mówię źle, albo że nie zaczęliście mnie poprawiać, że coś tam powiedziałam źle. Dobra, słuchajcie, kończę i zaraz mam nadzieję, że będę umiała to zapisać, bo też kurczę, strasznie się tym stresowałam, czy będę mogła to zapisać, w ogóle włączyć, później wyłączyć, dołączyć. Monika miała w ogóle tłumaczyć, a jej nie umiałam włączyć w ogóle, także już żeście mi napisali, że się nie da włączyć. No. Dobra, kochani, trzymajcie się, nawet filtra nie włączyłam, wyglądam fatalnie, kurde, jakiś tu... O, Monika jest teraz! Wariatka.